Hello, this is Dr. Kingston, and I am here to discuss the boundaries, subdivision, and contents of the oral cavity. The objective for this video is simply to describe exactly what the title says. What are the boundaries, subdivisions, and contents of the oral cavity? The oral cavity is bounded superiorly by the palate, which divides it from the nasal cavity. Anteriorly, the hard palate is formed by a sheet of bone, but posteriorly, the soft palate provides a sort of mobile separation with the nasopharynx that can be opened as closed as you need it. The posterior border of the oral cavity is the palatoglossal arch, which can be traced up inferiorly from the soft palate. This arch is created by a fold of mucosa over the palatoglossus muscle, which elevates the tongue, as we're going to learn in a later video. This posterior border is what you might call an incomplete boundary. So as you can see, if you look in the image there, there's a clear passageway into the fauces, or the throat, where the palatine tonsils sit. The lateral and anterior boundaries of the oral cavity are formed by the cheeks and the lips. Both of these create pliant walls that you can change in size and shape as you flex or relax different muscles of facial expression. And inferiorly, the oral cavity floor is formed by the mylohyoid muscle, which originates from the mandibular body at the mylohyoid line and joins right and left sides in the midline to form a sort of hammock that supports the oral cavity. Within the oral cavity, we divide the area external from the occlusal plane of the teeth. So this plane formed here when the superior and inferior teeth meet, from the area that's internal to that. Internal to the occlusal plane is considered to be the oral cavity proper, and external is the oral vestibule. Within the oral vestibule is where we're going to find the anterior and buccal surfaces of the teeth and gingivae. There's several prominent folds of fibroelastic connective tissue covered by mucosa that connect the gingivae out to the lips and the cheeks, as you can see on the image on the left. The two that anchor the gingivae to the lips are called the labial frenula, and there's one for each of the maxillary and mandible gingivae. These are embryological remnants, and they can actually be quite variable in size and prominence from person to person. Occasionally, they end up being so large that a person has what's considered to be a lip tie that limits the mobility of their lips, and on those occasions, they can be surgically reduced. The oral vestibule is also a site for saliva secretion. So not only are there many minor salivary glands within the mucosa that lines the lips, the cheeks, the gingivae, we can also find the opening here of the parotid duct lateral to the second maxillary molar. This opening is surrounded by a small papilla, which is palpable both on yourself and on your future patients. Moving on to the lingual side of the teeth then, we end up in the oral cavity proper, and we find that this space is very much dominated by the body of the tongue. It is far and away the biggest thing in there, and I can pretty much guarantee you that you're not going to be exactly aware of how big your own tongue is for at least the next 5 minutes. The tongue is tethered to the floor of the oral cavity by a band of fibroelastic connective tissue called the lingual frenulum. So just like the labial frenula, this is an embryological remnant and very variable between individuals. You might have heard the term tongue-tied before, referring to someone who's having trouble speaking clearly, but the term actually refers to a condition called ankyloglossia, where the lingual frenulum is very robust and it extends very far anterior along the floor of the oral cavity, literally tying the tongue down. It's not a dangerous condition, but it can cause trouble with speech and especially trouble with infant feeding, so it's usually surgically trimmed back. We saw the opening of the parotid duct in the oral vestibule, and now we're going to see the openings of our other large salivary glands in the oral cavity proper. So on either side of the lingual frenulum here are sublingual caruncles, which is a fun word to say. These are little mounds of tissue that the submandibular ducts open from. The submandibular gland, remember, it sits down mostly in that submandibular triangle, but it has that little thumb piece that sneaks up underneath the mandible and sends out its duct anteriorly and medially, where it will open through these caruncles. Lateral to the caruncles, you can follow the sublingual folds out laterally to the teeth. These folds are covering up the sublingual glands, and these are home to many small salivary openings. The sublingual glands aren't like the parotid gland or the submandibular gland that have one big duct that exits and empties their secretions into the oral cavity. The sublingual glands have many small ducts, and these are going to open up directly onto the oral floor here. The last space that I'll mention here, because it's technically part of the oral cavity, is the sublingual space. This sits between the mucosa that covers the oral floor and the mylohyoid muscle. This is where you'll find the body of the sublingual gland, the submandibular duct, and all of the neurovasculature that's supplying the tongue. Now, there's enough going on anatomically in this region that we've chosen to give it its own learning objective and its own video. So we'll cover it in more detail there, but know that this is considered part of the oral cavity. All right, that is going to bring us to the end of the content here and to your review question. Please take a few minutes to answer the question thoroughly, and then I'll walk you through the answer. The answer is D. The parotid papilla can be palpated in the oral vestibule immediately lateral to the second maxillary molar. That is going to bring us to the end of this video. Thanks for watching.